My name is Kelsey Hanlon, and I'm a doctor of physical therapy at Wendy Webb Schoenwald Physical Therapy and Vestibular Rehabilitation. Today I'm here to talk with you a little bit about Parkinson's disease and how we treat it. I myself have been treating Parkinson's disease for 8 years, and I truly enjoy working with patients of this population. The cause of Parkinson's disease has not been well determined. There's thought to be a genetic component as well as environmental influences. In only about 15 to 25% of the cases, there are people who have a genetic link to someone else who has a disorder. But in only 30% of those cases, there's been a specific gene mutation associated with the disorder. So for many people, it's not known why this happens. There have been hypotheses including, well water, pesticides, brain injury, those types of things, but there's no one definitive reason or prediction for someone to get the disease of Parkinson's. People at any stage of the diagnosis of Parkinson's disease can benefit from physical therapy or increased activity and see some improvement in their quality of life. However, the earlier that we can intervene, the better it is and the more likely that you will see more reduction in your symptoms. This is a little bit of a problem because current estimates state that between 5 to 10 years pass between the first onset of the patient's symptoms and when they're actually diagnosed with the disease. So this means over that time, people are not seeking the correct care because they're either misdiagnosed or not diagnosed or not recognizing that there's something going on. So we're missing a really important therapeutic window where we might be able to reverse some of the symptoms of Parkinson's disease. So once the diagnosis is made, it's important to get in as quickly as possible to see a specialist or someone who might be able to prescribe some sort of medication for you, or to see a movement disorder specialist like a physical therapist to try to help you get on the right track. Physical therapy treatment for patients with Parkinson's disease involves the emphasis of amplitude or large movements. A lot of times the people who have Parkinson's don't realize that their movements have become smaller or their posture has become, more forward flexed, or their arms are not swinging as much as they had before. And because this feels normal to them, it feels very unnatural for them to move with the actual correct amplitude. So we focus on trying to get people to move with this bigger amplitude, which is really more normal, and sort of retrain the brain into accepting this motion as the normal motion. So this process is called sensory recalibration, and it takes a lot of repetition and a lot of practice. So initially, the person will need a lot of external cues, whether that be from the therapist or from reminders on the wall or from their caregivers telling them, move big, take big steps. And then eventually that process becomes internalized, and we would call that calibration, when the patient has calibrated to learning the new normal motion. If you come to our clinic with diagnosis of Parkinson's disease, typically the therapist will take a history, figure out which symptoms you're noticing, which things happened first, where the symptoms are really impacting your life, and then develop a plan to try to work on these symptoms. Again, we're going to be focusing on large amplitude movements, but also as many functional things as we can to really improve your function at home and in the community. We'll do a lot of balance testing initially, static, still, and moving. We'll look at your movement patterns. We'll look at actually the things that are challenging for you and see how you're doing them. If there are ways we can brainstorm doing them differently or better or more easily. And then once we have this general picture, we can decide together a treatment plan. Aerobic exercise has been shown to reduce symptoms in patients with Parkinson's disease. Aerobic exercise is defined as any type of exercise that gets your heart rate up, where you might be getting a little bit tired or a little bit sweaty. So if you're thinking about exercising at an intensity that would be sufficient enough to create change for Parkinson's disease, you want to be working at a 7 out of 10 effort on a 0 to 10 scale. So 0 being no effort at all, 10 being working as hard as you possibly can. You kind of want to be around a 7. So that means you should be able to be having a conversation with someone still, but it shouldn't be easy to have that conversation. You should be huffing and puffing a little bit. The goal would be to be able to achieve that type of exercise and sustain it for 20 to 30 minutes a day. This exercise can come in any type of form that you like. I usually recommend that people pick something that they enjoy so that they're more likely to consistently do it. So that could be jogging, walking, swimming, biking, anything that's going to get your heart rate up and keep it up. Exercise has been shown to improve neuroplasticity in your brain. So neuroplasticity is actually the brain's ability to make changes in itself. So to rewire and create new connections. And so it's by this process of neuroplasticity that some of the symptoms of Parkinson's disease can be mitigated. Another important thing about aerobic exercise is that it naturally releases dopamine. So when you exercise and people get that runner's high sort of feeling, that's the release of dopamine in the body. So anything we can do to promote release of dopamine when we're, creating less of it is helpful for trying to manage those symptoms.